Welcome to our presentation on lung diseases, focusing on their causes, symptoms, and diagnosis. Today, we will delve into the specifics of bronchitis, a common lung condition. Bronchitis is an inflammation of the airways leading into the lungs. When the airways get irritated, they swell up and fill with mucus, causing a persistent cough. This condition can be caused by viruses, smoke, and other irritants. There are two main types of bronchitis, acute and chronic. Acute bronchitis is usually caused by a viral infection and resolves on its own. Chronic bronchitis, however, is a long-term condition that falls under chronic obstructive pulmonary disorder, or COPD. Several factors can cause bronchitis, including inhaled irritants like smog and industrial pollutants, smoking, repeated viral infections, and chronic GERD. There is also a genetic factor associated with COPD, particularly a deficiency in alpha-1 antitrypsin. Chronic bronchitis is characterized by the overproduction of mucus and hypersecretion by goblet cells. This leads to airway obstruction and irritation, causing symptoms like hyperemia and edema in the bronchial mucous membrane. The clinical manifestations of chronic bronchitis include wheezing, breathlessness, a tight chest, persistent cough, and excessive mucus production. These symptoms must be present for at least 3 months a year for 2 consecutive years to be considered chronic. Diagnosis of chronic bronchitis typically involves a chest X-ray to check for large, horizontal heart and increased bronchial markings. Blood tests are also conducted to identify any genetic markers like alpha-1 antitrypsin deficiency.